smell them. Yeah, that's it.
Oh, wait a minute, I have to move this paper press.
Yeah.
Good afternoon, everyone.
Hello.
How are you doing?
Good.
All right.
Today I would like to talk to you about the two types of nurses and the differences between them, okay?
Okay.
A nurse holds a vital role in the healthcare industry. Nurses are the mediators between patients and their physicians. Physicians rely on nurses to be accurate with records in order to provide quality health care. There are two types of nurses: a registered nurse, also known as an RN, and a licensed practical nurse, also known as an LPN. Although both are classified as nurses, there's differences among them. I have been an LPN for a year, and I'm currently pursuing an associate's degree at Northwestern State University. Today I would like to share with you knowledgeable information regarding nurses, the LPN and the RN, and the differences they share among them include level of education, scope of practice, and their salary. To completely understand what a nurse is, I'm going to provide you with knowledgeable information. What is a nurse? This is provided to us from Webster's Dictionary on the internet. A nurse is the person who cares for the sick, infirm, specifically a licensed healthcare professional. Sounds right, huh?
Mm-hmm.
Yeah. Types of nurses include a registered nurse, or an RN, a licensed practical nurse, or LPN. The definition of a licensed practical nurse as provided to us from Webster's Dictionary: a person who has undergone training and obtained a license to provide routine care for the sick. The definitions provided to us from Webster Dictionary on the internet. So, registered nurse, a graduate trained nurse who has been licensed by the state authority after passing qualified examination. Both sound similar, huh?
Mm-hmm.
They're both classified as nurses, but again, there's differences between those. The differences between the RN and the LPN: level education, scope of practice, and their salary. When we look at the difference of the level education, an RN attends a university to attain a degree, either an associate's degree or a bachelor's degree. Associate is a 2-year degree, a bachelor's is a 4-year degree, and the difference between those is more of a management type of position where the bachelor's, the nurse who attains a bachelor's degree is able to hold a management position and be a director of nurses of a nursing home or director of nurses of a hospital setting. When we look at the education of an LPN attends a technical or vocational school to obtain a certificate, and that come from the practical nursing from Northwestern Louisiana Technical College, and then the RN's level of education come from the Associates of Science from Northwestern State University. And here I've provided you with a curriculum. This is the bachelor's degree curriculum, and I don't think you can see it from where you're sitting, but it gives you the freshman, sophomore, junior year in their curriculum for bachelor's degree. And this is from Northwestern State University. And then again from Northwestern State University, this is an associate's degree, and again that's the curriculum for those. And then a licensed practical nurse comes from Northwest Louisiana Technical College, their practical nurse curriculum. And later on, if you guys want to look at this, you're more than welcome to. It provides great information. Maybe you guys want to obtain a nursing degree, so if that's the case, you can look at these slides and look at their curriculum. Okay, and another difference is their scope of practice, right? We discussed that earlier. you say, what is scope of practice? Well, a scope of practice is a tool provided by the Louisiana State Board of Nurses. It tells the nurses if they're able to may be useful in working through a practice or delegating nurses through issues. It's basically what it says is, can that nurse do that procedure, or is she capable of doing that procedure? And the delegation, can that nurse, if she's busy, can she pass it along and let somebody else do it, such as an aide or someone like that. So that's what scope of practice means. Now, this is the licensed practical nurse scope of practice, and here in the scope of practice, it says that they do not say that the LPNs can't do anything. It says we don't have a laundry list of what an LPN can and can't do. But when you get to the RN scope of practice, and this is the RN scope of practice, and this comes from the Louisiana State Board of Practical Nurses, Louisiana State Board of Nurses. It tells you that the LPNs can't do such things, and the RN has to do it, such as the initial assessment of the patient, pushing IV medications, or administering blood. And again, if you guys want to look at this, you're more than welcome to. And then the final difference is their salary. In Louisiana, typical wages for an RN are between $23.94 and $33.55 an hour, and wages for an LPN are between $15.56 and $20.67 an hour, and that comes from the Louisiana Workforce Commission. In summary, a nurse, whether an LPN or an RN, are vital components to the healthcare industry. The nurse is the eyes and ears for the physician. Those involved in nursing profession work in many different settings, performing duties related to their scope of practice, level of education, and license earned. There are two types. It takes a special person to be a nurse. Two types of nurses are LPN and RN, but there are differences among them. Finally, you have learned that there are two types of nurses, and you should be able to identify the differences between them. Although there are differences, they share a common responsibility, and that is patient care. Thank you, guys.
Oh, that was beautiful.
Beautiful, beautiful, beautiful.